The definitive diagnosis of primary sclerosing cholangitis is basically made on the imaging. We do certain types of imaging procedures, the important ones being the various types of procedures related to the cholangiography, which is used to visualize the common bile duct and the pancreatic duct and the hepatic duct. How can we visualize these biliary structures? The major procedure is ERCP, endoscopic retrograde cholangiopancreatography. What happens in ERCP is we pass a scope through the gastrointestinal tract, and along with that, at the end of the scope, we have a camera attached. And at the level of the ampulla of Vater, we are going to visualize the biliary tree by inserting a dye. So that dye makes all the structures very prominent, and they are very helpful in visualizing the biliary tract. This can also be done in a MRI form, and that is termed as MRCP, or magnetic resonance cholangiopancreatography. In this, a dye is injected into the person that goes through the biliary tract, and then we perform serial MRIs to find out how the dye moves through the biliary tract. This is a non-invasive test. This is done in patient who cannot undergo ERCP because if someone, there are certain contraindications to ERCP. For example, if someone has the development of pancreatitis, then we should avoid ERCP in those patients. And if you suspect pancreatitis, then ERCP should not be performed. Another procedure which can be done is percutaneous THC, or percutaneous transhepatic cholangiography. As the name indicates, it is a percutaneous procedure in which we visualize the transhepatic or the biliary tree by injecting a dye, and then we percutaneously, and then we visualize the various stages by the radiographical procedures. Let's look at all of these imaging techniques in just slightly more detail. MRCP, or magnetic resonance cholangiopancreatography, it is very commonly performed. What happens is, what are the findings on the MRCP that make us suspicious of the patient having PSC? There can be the beading pattern or the alternating dilatation or narrowing. As you can see, this is the picture of an MRCP procedure done. This is the liver, and the whole bile ducts, hepatic ducts are explained here. And this is the common bile duct. Along with that, there will be cystic duct somewhat here like this. You can see on the MRCP that there is not a normal flow of the dye from the liver to the duodenum. There is certain type of beading, narrowing. There are certain beads on a string appearance, just as we see. This is going to be very evident on ERCP picture, which I'm going to show in a minute. But these arrows show you that there is certain type of stenosis, and along with that, upstream dilatation. Like here, you can see stenotic picture. And if we zoom this picture, you can see this is a dilatation, and then there is narrowing or stricture formation. Along with that, there is dilatation here. So just as a smooth pattern, a smooth presentation as we see upstream here, in the bile duct, we see that there is dilatation and narrowing. And this is very suggestive of primary sclerosing cholangitis. If we look at the similar patient, what is the picture on ERCP? If we do the same procedure endoscopically in ERCP, or endoscopic retrograde cholangiopancreatography, you can see here that first on the right side, this is the classical beads on a string appearance, just like when you have beads on a string with alternating dilatation and narrowing. It is evident upstream here as well. There is certain dilatation, then there is narrowing, then there is dilatation and narrowing, and it is very prominent here with these beads-like pattern. This is the classical presentation on ERCP when we inject a dye and we take radiographs to find out that this is the pattern here. This is also evident somewhat here in this dilatation of this segment of the duct. There is dilatation here, then there is slight narrowing here, there is narrowing here. So there is no smooth flow of the bile, or there is no smooth track flow from the liver to the duodenum. So this is a classical picture, and this is used for definitive diagnosis of ERC, of primary sclerosing cholangitis. We do the labs first, and if we have a clinical suspicion, then we can do the imaging to definitively diagnose these patients. Another procedure which can be used alternatively is percutaneous transhepatic cholangiography. This is performed percutaneously, and in this we also inject a dye into the biliary system, and then we measure the flow of the bile through the liver tract. And along on these pictures, it is also the similar picture is evident with this narrowing and constriction. There is constriction as well here, and there is upstream dilatation. So there is just like as you can see, the pancreatic duct is very smooth. There is no problem with the pancreatic duct. But in the bile duct, you can see that there is alternating constriction and alternating dilatation. So this is a very suggestive picture of the obstruction to the bile flow, and it is a classical representation of primary sclerosing cholangitis. If we have even further suspicions, if we suspect certain other pathology, then we can move onwards with the more invasive procedures like the liver biopsy to have a complete diagnosis. For example, if we want to distinguish primary biliary cholangitis from primary sclerosing cholangitis, then we can do a liver biopsy, and the liver biopsy will show us the concentric onion skin appearance, which we talked about in the pathology section of the lecture.